So coming to question 3, a 23-year-old male college student visits the health clinic complaining of an intensely pruritic rash involving his axillae, waist, periumbilical skin, and inner thighs. He reports pruritus that is worse at night. He notices the rash after a recent fraternity party 4 weeks ago. A physical examination reveals multiple excoriated small papules with burrows distributed in a serpentinous pattern. An image of the lesion is shown below. Which of the following best describes the mechanism of action of the first line agent for this condition? Okay, this is your question, and these are your options. Option A, inhibition of acetylcholinesterase. Option B is blockade of GABA A receptors. C is delayed repolarization of voltage-gated sodium channels, and D is formation of pores in the membranes, and E is formation of free radicals. So we'll go to the majority answer. To male college student who comes with an intensely pruritic rash, which involves axillae, waist, periumbilical skin, and inner thighs. Okay, and the line that gives it away is he reports pruritus that is worse at night, and then the rash was in when he was at a fraternity party 4 weeks ago, so he was in a crowded place or something. And then, as you can see in the image, there are multiple excoriated papules with burrows. Okay, so this burrowing distribution, multiple small papules, and multiple axillae, waist, or your finger, the space between your fingers, these places, when they're involved, and pruritus at night. This is a picture of scabies. So they want to know the mechanism of action of the first line agent. So can anybody tell me what is the first line agent? Then we'll go to the mechanism. Yes, very good. Permethrin. Excellent. So permethrin is the first line agent, and the mechanism of action of permethrin is basically it delays the repolarization of voltage gated sodium channels. So when it delays these voltage gated sodium channel repolarization, it will prevent neurotransmission, right? As a result, it will lead to death of the mite, right? Paralysis, it paralyzes the mite and it leads to death of the mite. Okay, so some of the other things which can be used in scabies and also other places. So I'll discuss whatever is related over here. So anybody would like to tell me inhibition of acetylcholinesterase, which antibiotic? Yes, the drug is permethrin. Okay, Permethrin. It is the first line for scabies, and the mechanism of action is delayed repolarization of voltage gated sodium channels. So with delayed repolarization, what happens is your neurotransmission is affected. This will lead to paralysis of the mite causing your scabies infection and eventually death. All right, is it clear? Yes, so related to scabies, I'll be asking you the drugs. So inhibition of acetylcholinesterase. All right, excellent. Someone has already answered. Malathion, right? It's basically an organophosphate. So it's the same reaction, same mechanism of action. So malathion can also be used in scabies, but not the first line. All right. Then blockade of GABA A receptors. Would anyone like to try? All right, excellent. So blockade of GABA A receptors is lindane, the mechanism of action of lindane, right? So lindane, malathion can be used in scabies, and permethrin is the first line. And also one more drug which you should be aware of is oral ivermectin, which can also be used for scabies, but not actually the first line, but it can be used. So would anyone like to try the mechanism of action of oral ivermectin? All right. So ivermectin basically it binds to the chloride channels in the nerves and the muscle cells. All right. And same, it prevents neurotransmission, paralysis of the mite, and eventually death. Right? Is it clear? Are all the drugs related to scabies clear to everyone? Give me a quick yes so that we can proceed to the next. So why I'm discussing all the drugs is so that at one place you have everything figured out, and these mechanism of actions, the number of times you repeat them, that's how you learn them. There's no other shortcut to it, unless of course you're using Sketchy or something. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.